I think we are being live streamed now.
Yes.
Good evening, good morning, Assalamu alaikum. Welcome to this policy webinar organized by Power and Participation Research Center. We have our study partner, BRAC Institute of Governance and Development with us also. We have the topic today is COVID-19 impact and social protection challenges, urban and the new poor. We have a wonderful panel to review and debate these issues. I would like to introduce the panel now. We have Dr. Shamsul Alam, who is the member GED, Senior Secretary, Bangladesh Planning Commission. We have Ugo Gentilini. He is the global lead on social assistance with the Social Protection and Jobs Global Practice of the World Bank. We have Qazi Azmat Isa, who is the CEO of Pakistan Poverty Alleviation Fund. We have Usha Mishra, who is an old friend of Bangladesh. She is now the Chief of Social Policy, Evaluation and Evidence at UNICEF Nepal. And we have Asif Saleh, who is the Executive Director of BRAC. So that's the panel. I have my colleagues, as I mentioned, from PPRC, Syed Hashmi, Mama Zillur, Namira Shamim, and Wazid Mahmood, Abdul Wazid, and also Imran Mutin from the BRAC Institute of Governance and Development, and many others who have joined. So thank you all for joining. We have structured the evening with two initial presentations. One starting with myself and then by Ugo Gentilini. We will then have reflections from three country experiences, starting with Nepal, then Pakistan, and then Bangladesh. And then we'll round it up with comments from the senior member from the government of Bangladesh, Dr. Shamsul Alam. We will also have a Q&A session opportunity, particularly those who would like to give comments or ask questions through the chat box. Our team will be continuously monitoring the chat box for that purpose. At the end, we shall also be launching a publication. PPRC and BIGD has collaborated on a year-long 3-round study on the COVID impact on livelihoods and recovery. That book has now been published. We shall be, myself and Imran Mutin will jointly launch the book at the end of the program. We'll round up with a review of how we see the road ahead. So without further ado, let me start the presentation, and I'll request our team to share the PPRC presentation on the screen. While they're doing that, we have planned for this to be a 2-hour session, and we shall all be mindful of the time in that context without detracting from the very important insights that we'd like to share. So we have titled it COVID-19 Crisis and New Vulnerabilities, Urgency of Rethinking Social Protection. That's how we have seen the scope of this discussion. Next. 4 vulnerabilities of the COVID-19 crisis that we'd like to bring out. I should mention here that there is a wealth of data and analysis and reports behind these very short highlights that we are presenting. So I would focus on these 4 vulnerabilities which emerged during the COVID-19 crisis. First one is the earning uncertainty of informal occupations. Our study showed that 1 year from the crisis, income levels were still 7% below pre-COVID levels and double that in the urban context. 8% were unemployed, 41% had to shift to lower skill jobs. So earnings uncertainty of informal occupations, that's the first vulnerability we'd like to underscore, because what I'm doing is to set up who is the client for the new thinking on social protection that we are looking for. The second vulnerability is the rising non-food expenditure burdens for low-income urban residents. We found this to be a very important phenomena, not just the loss of income, but that many of the non-food expenditure burdens for urban residents, particularly low income, these are like inelastic. They have to be borne whether you have income or not. And there was a rising trend of this. The study showed that 98% rise, nearly double in this non-food expenditure burden on rent, health, transportation, utilities, even education. The third vulnerability is eroded financial coping capacity. On average, savings depleted by 11% in urban and 24% rural. On the other hand, debt as a proportion of annual income doubled over the 1 year of COVID from 13% to 26%. So eroded financial coping capacity is also a reality defining these new vulnerabilities. And the fourth vulnerability that we mentioned is what we have categorized a category, the new poor, who are unaddressed by traditional social protection. This is a new candidate for social protections. Households who slipped into poverty and were unable to regain pre-COVID income levels 1 year into the crisis and were facing, attempting to recover with eroded financial coping capacity. PPRC BIGT studies extrapolating from its survey data estimated the national size of this group to be at 24.5 million in March 2021. This, of course, there's an element of transient poverty within this category of new poor, but we found that 1 year into the crisis, there was a significant chunk who had slipped into poverty, were actually caught in a trap of uncertain income, rising non-food expenditure burdens, and eroded financial coping capacity. And therefore, there was a new candidate, so to say, to which social protection needed to be addressed, but it was not traditionally addressed as such. Next. So, besides the issue of the new poor, in general, urban poverty too has not figured much in the social protection coverage. Generally, social protection, I'm talking of Bangladesh, has ignored the urban poor, but commendably, a token start was made in 2020. But you can see, some of the regular programs, you can see the percentage share of urban is less than 1% in 2019-20. Old age allowance, widow allowance, disability allowance, these are mostly rural focused programs. Urban poor has not in that sense figured in the social protection. Next. But in 2020, under the COVID crisis pressure, there was a beginning of a response from social protection angle. But as you can see, still it's more on the rural side than on the urban side. These figures, GR means generalized relief, VGF is vulnerable group feeding, OMS is open market sale of rice. But there are more programs for the rural, and the particularly innovative one, if I go down a little, you can see that there was some innovation of a sort of a semi-addressing the problem of the new poor by a unconditional cash transfer program, but this was wholly focused on the rural population. The urban had missed out there. Next. So We also looked at, how much the exact government response to social protection response to the COVID crisis, to get the insights of what was the policy thinking going ahead. So in terms of the financing trail, what we found was that there was not too much of additional amount invested in social protection. It was mainly a focus on repurposing existing programs towards these emergency responses. So this is an important issue here, that some attention has been made, but the focus was not on additional funding, but on repurposing some program, earlier program focus, as well as utilizing the contingency funds. So practically there was, in terms of new net addition of social protection programs targeted to the poor, it was a limited amount. Next. So 3 insights on this financing response. The social protection response to the COVID-19 crisis was primarily financed through repurposing existing allocations rather than additional new financing, which I just mentioned. It did not trigger any major expansion in social protection allocations. The share of the SP budget rose marginally from 16.32% in 2019-20 to 16.83% in 2021. There's a new budget where there's a slight rise there also. So there has been I may summarize the official social protection response in this manner. They tried to utilize existing funds for COVID crisis purposes. Secondly, there was not much of additionality, so fiscal constraints were taken into account, but I think that issue of fiscal constraint may not be the main consideration here. I think there is a need for sort of, in a way, advocating why this urban and new poor requires a bigger attention from the social protection perspective. And that's the reason why I have this purple circle, which says that while allocations saw no major expansion, policy interest in digital transfers for cash-based program saw a distinct boost. So some initial interest in the policymaking world has been seen. Now this needs to be built upon. Next. So lessons from the COVID-19 response. I think many of us, when we just provide the expert advice, the people in the driving seat, meaning in the government, they often have to consider multiple factors. So there has been political considerations also underpinning the policy response. There was a focus, Bangladesh in a way focused less on the social protection response, more on trying to get the economic recovery kick-started. So they saw the policy perspective here was COVID-19 was going to be a short-term affair. But unfortunately, as we have seen, now the policymakers have realized this is going to be a longer-term affair, and therefore social protection has to become a bigger priority. And fiscal priority, as I said, was given to the economic recovery agenda. And though attention was made on the social protection agenda, it was more with repurposing it rather than additionality. And the focus was really on the emergency response so that pandemic-related discontent does not escalate into broader social unrest. And the focus on longer-term policy reforms was not, in a way, upfront concern. But over time and with appropriate advocacy, hopefully this will become a concern. Next. So finally, this is the final slide. So while potential windows have appeared, greater momentum is not a given, because this year's budget in Bangladesh also saw hardly any major movement on the social protection additionality in terms of budgets, and focus on the group such as the new poor. So there is the 5 musts that we want to highlight. Improved vulnerability mapping, especially including population at risk of backsliding into poverty, as well as the out of focus urban poor. Our study, which introduced the whole theme of the new poor back in 2020, has generated a policy debate where the government is also now engaged. So hopefully this debate will continue, and the wisdom of addressing this new category of new poor will be, will see a policy resolution at some point. But I think the small efforts that we have seen also underscored the importance of community engagement to overcome many of the last mile governance challenges, particularly on beneficiary listing and verification. Because just digital databases will not appear out of the blue. That task of listing and verification is very important. And there, the last mile governance challenges was one of the issues that our study also brought out in 2020 as well as in early 2021. Early warning systems through more effective data monitoring, that's an issue. Improving social protection system capacity, particularly coordination issues, is important. And flexible financing mechanism. The repurposing that was done, that was an innovative response, but we have to plan for more innovative and flexible financing mechanism, because such crisis may reappear in the future in other forms. So it is important that this is not seen as just for this year, but the social protection agenda for the future. The lessons have been learned here. I'll stop here. This was like an opening from our studies on the key insights. If you can stop sharing, we will now, I want to bring in at this point in time, Ugo Gentilini, who has been really looking at this whole issue of what urban safety nets may look like, which ones should attract more attention than others. So without further ado, let me invite Ugo Gentilini. Ugo, the floor is yours. We'll be mindful of the time, of course.
Thank you very much, Zilur. I'm trying to upload the presentation here. I hope it's visible. Great. Okay, fantastic. Thank you so much, Zilur, and thank you, PPRC, for having me. Great pleasure to join you after many years, and really fantastic intro, Zilur. And really look forward to the book that is going to be launched later. What I'd like to do today is just to reflect a little bit on some current urban social protection programs that have been implemented as part of the COVID response, connect that conversation with the nascent urban social protection provisions that were in place before COVID, and try to identify some threads and lessons for the future. So one useful way to start a conversation is always looking at the facts. And here I'd like just to lay out 3 stylized facts. One is almost an empirical regularity, starting from the left. When we look at social assistance overall, whether it's cash or in-kind transfers, the coverage of the poorest quintile is systematically lower in urban areas. So for the South Asia region, as defined by the World Bank, the difference is on average about 10 percentage points, ranging from 3 to 15. When we zoom into cash transfers in particular, and that's the central figure, the gap widens even further. And that happens even in mature programs like Brazil's, for example, where the gap is about over 35 percentage points. But then that doesn't mean that progress hasn't been made. Look at Brazil itself. There has been a lot of progress in extending coverage, also in urban areas, of course, at the somewhat a slower pace than in rural areas, but there has been progress. And that progress is a result of what I would call kind of a first generation of interventions. There are about 24 countries that have extended rural provisions somewhat gradually to urban areas through a series of adaptations over time, or have started directly in urban areas with urban specific programs. And I would argue that COVID has shed new light on the vulnerabilities of the urban poor and beyond, and somewhat kickstarted a second generation of interventions. And I'm going to say a little bit more about them. But before that, let me just reflect on why is there this gap between urban and rural areas in terms of coverage. And, this is based on my own experience and exposure to the issue. I'm pretty sure there are other reasons as well, but I try to organize them around 3 buckets of issues. One is the way one conceptualizes and measures urban poverty. So the moment that poverty is not necessarily defined in terms of rates or in consumption terms only, the picture and distribution and the locus of poverty can actually change. So there is a whole agenda on how to conceptualize and measure it that can explain why sometimes and oftentimes urban social protection is of lower coverage. Another relates to attitudes and narratives. There is somewhat a perception that social assistance is not needed in cities because there are opportunities. There are jobs, and so not really cash transfers under interventions may not be needed. Another is somewhat the lingering skepticism around cash transfers that exists also in rural areas in some cases, but is somewhat amplified in urban areas, and these fears of generating dependency or inducing further migration or creating work disincentives. It's somewhat there. And also I think there is an issue of how the narrative is presented on social protection that may not always necessarily be understood by city administrators. So there is an issue of how one tells the story in urban development terms. I'm going to also come back on that point. And finally, there is kind of a bucket of operational issues on how to make programs attractive to urban populations that face high transaction costs, high opportunity costs. And there are specific data and delivery and institutional issues as well that make urban environments different. And then COVID happened. There's been a massive scale up in social protection, over 3,000 programs over the past year and a half, for a total spending of nearly $3 trillion. As Ziller said, this is not necessarily all new financing. There is a lot of repurposing here as well. But overall, the coverage of cash transfers in particular is about 1.3 billion people. And this is quite unprecedented, I think. And when we look at urban areas, we see that there are at least 43 programs that are designed for that purpose, and reaching at the moment a little over 18 million people. These are actuals. The plans are about 66 million. So these are programs that are in the making. And they mostly do so through unconditional transfers. Although we see also some interesting in-kind program and even public works. I'm going to mention a few examples of that. But overall, design is being kept simple because of the nature of the crisis, and is mostly in terms of unconditional transfers. Now, how did that expansion occur? Some countries leverage existing schemes, like Ethiopia. They have an urban safety net, and that was used to provide more generous transfers. Others have introduced new programs. At least 11 countries in Africa did so. New voucher schemes in cities like Seattle, and there have been some interesting innovations on the business process and on some design features in countries like Nigeria and Togo. And there have been new ways also of thinking of public works, as I mentioned. There is an interesting set of pilots with digital public works, still quite small scale, about 1,300 workers, but looked at ways of, for example, geolocating slum services through applications, through devices, updating street view predictions. So there is an interesting set of activities that may actually also be useful to think about post-COVID. And across the board, there has been an easing of administrative processes. And even in high-income countries, here I'm mentioning the example of the US SNAP program, which is an electronic voucher scheme where home visits for eligibility were replaced by phone interviews. Online purchases are allowed. Notary certification processes are required, but only periodic reports from the person. Now, this doesn't seem to have affected the performance negatively in any way, but the jury is still out whether those streamlined processes will be retained post-pandemic. I'd like to give you a couple of examples, also very concretely, on what's happening, including in some of the lower income countries that had very limited systems in urban areas to start with. So countries like Sierra Leone has a program that deliberately targets informal sector workers. So to do that, the geographical distribution of the program happened in proportion to the distribution of those informal sector workers across the country. And what is interesting is that a number of different sources of information were used, like for the specific identification of those workers, because they are not present in national registries or other sources, like the use of street trader associations, market surveys, and tourism sector workers being involved. So there was an extended range of innovative sources of information that were harnessed and tapped for generating information on informal sector workers, and plus some of the pre-existing steps, including a PMT that was in place, had been also made much leaner. And in contexts like Kinshasa in DRC, there's been a lot of work with geospatial data to identify particular informal settlements and slums, and then working closely with private sector providers, and in particular mobile phone providers that have been able to provide anonymized information on the users and the criteria on the usage of data plans and the availability of smartphones, etc., were part of the targeting process. And then those people will reach through text messages inviting to enroll and then providing information. So there has been a lot of ongoing partnerships with the private sector as well. And in countries like Nigeria, where some of the data was somewhat outdated, it came from 2018 and 19, machine learning techniques were used also to identify particular areas in urban settings. And those, as you can see from the central graph, did predict wealth in a way that is quite consistent with surveys, and hence that was used really down at very granular level to identify particular grids in cities, and then there were other steps in targeting, but this was kind of some of the initial steps that were used to machine learning. Other ways to streamline and make assistance more rapid in cities included the setup of special lists and special registries, like in Nigeria or in Madagascar, that were then connected to pre-existing registries as well, which were therefore expanded. And in some countries, the registry were not used at all. So Togo, for example, used an ID and voter registry that included information on occupation as part of the implementation process. So that we see also a lot of diversity in that regard. And some of the classic functions throughout the delivery chain were unified at some point, like Sierra Leone, for example, payments and enrollments were done at the same time. So let me just conclude with what are some of the initial lessons. And as countries have expanded their COVID assistance in cities, they face this trade-off between providing assistance rapidly versus targeting precision and versus extensive awareness campaign. And a bit of a premium was put because of the nature of the emergency on acting fast. So the question of whether assistance was timely depends on probably on a couple of forces at play here. First, that we know that it takes between 6 to over 50 days less to reach beneficiaries using pre-existing databases. The thing is that in most urban areas, those databases were not in place. So it may likely take a little longer. On the other hand, we also see that where conducive conditions are in place, electronic payments are much faster than manual methods, and those electronic payments are largely used in urban areas. So their timeliness at the end is a battle among those two forces. Differently from the first generation that initially replicated in urban design, there has been, in this case, in the COVID response, a deliberate attempt from the get-go to adapt design, a recognition that urban areas are different and that the design had to be adjusted. There are still a number of lingering issues. What is a household and what is a community in city, and the challenges of working in areas that don't have clear demarcations. But it's also very evident that urban communities exist and can be mobilized for different parts of the delivery of assistance. Ethiopia has neighborhood committees that are very active in that regard. In Madagascar, we see similar involvement in a number of functions, and similarly in Cote d'Ivoire. There has been a lot of an exponential increase in the use of satellite images, again, at very granular level, wide simplification across the board on some of the steps, as I mentioned, the unification on some of the functions, and there is quite some interest on looking at the effectiveness and the efficiency and the timeliness of assistance when provided through big data versus more traditional methods. Evaluations are coming in, so we are looking forward to see some of the results. I would just say also that the registries were often not in place and had to be generated. In other cases, they weren't required at all. And in terms of generosity, what is an adequate program is often a question, especially when programs are not necessarily designed for food security or poverty alleviation objectives, but are actually meant to substitute for a living wage or the earnings that that people used to have. As Zilur said, I think over 20 million people in Bangladesh didn't recover from pre-COVID earnings. So the transfers were generous in urban areas, but were also short-term. So were they adequate during the period of the program? Probably so. Were they adequate during the entire year? That's more of a question. So this is my final slide. And moving forward, we shouldn't really think of social protection in isolation, but we have to think of the linkages, how social protection connects with other components of social protection. So how social assistance and insurance can be combined. Pakistan has some very interesting emerging experience in connecting cash transfers and matching savings. India's experience of tapping the public food distribution system to providing insurance to women-headed households. A big agenda on connecting with urban development, whether it's housing, whether it's how to work in fragile neighborhoods. And also the point that in social protection, we're often used to work at national level, but working with mayors and at municipal level is somewhat different. Big agenda to connect with jobs, interesting experiences from Ethiopia on providing cash transfers and activation and work experience in industrial parks. And overall, I think there is a wake-up call for social protection overall from the crisis and the need to be better prepared. And that may include having early warning systems with specific triggers that may inform scale-up decisions, something that is happening somewhat in the climate space, but much less in managing health pandemics. Work in urban areas means also being often in the political spotlight. There can be instances where the provision of assistance to a certain neighborhood that is highly vulnerable also coincides with a certain political affiliation of that neighborhood, that it can raise question, and that created delays in some instances. And as I mentioned at the beginning, I think there is still some skepticism on cash transfers that can be countered with the provision of evidence, but there is also a need for articulating and narrating social protection more in terms of through an urban development framework. One thing is saying we have an urban public work for garbage collection as part of urban poverty reduction, and one is trying to position that intervention within the system of sustainable waste management. So understanding and looking at cities as systems, it's very important, I think, for the future uptake of social protection in urban areas. Thank you very much, and I'll stop here.
Thank you. Thank you, Ugo. I think there was global wisdom at its best. And I think some reassuring sort of trends that you have highlighted, that COVID-19 revolution that you put a question mark though there, but I think the context has been set for innovative engagement on this whole issue of social protection, and lessons are, I think, being created around the world. It's will be useful to get these lessons in across countries. Now, we want to hear the country experiences. Asif Saleh will have to go off later, but I will first bring in Usha Mishra, who will share the experiences in Nepal, how they have been dealing with these issues, including this particular demographic of the children who are an important concern of social protection. Usha, over to you.
Thank you so much, Zalur, and welcome to all. And thanks for giving me this opportunity, Zalur, for sharing some of the insights. I hope it's useful. So overall, I would say that the experience of Nepal in addressing urban poverty, or rather poverty and vulnerability, COVID-induced, was, if I'm constructive, I would say evolving. And if I'm slightly critical, I would say slightly chaotic. So there was lots to learn. And I think as Nepal reflects back, having been in this situation for last 1.5 years, there are some good trends emerging, which I will end my presentation with, or my deliberation with. So it's really about finding a balance between addressing the chronic and the already vulnerable, and those who became vulnerable or those who became poor because of COVID. And what we saw, because we started implementing a longitudinal nationally representative survey consisting of 6,000 plus families with children, so we could estimate very accurately that the job loss in some metropolitan areas was much higher than in the other parts of the country. So there was obviously a very distinct urban slant to the job loss and the livelihood loss, and hence the emerging poverty or the new poverty and vulnerability. And this was not the only one which showed an urban slant. Even issues around protection, for example, violence in the community or inside the house, again showed an urban slant. And that again was captured by a survey. So there was obviously something going on there where COVID was having the deteriorating impact, or had exacerbated some of the experiences of living in an urban slum in a more with very, very limited space. And with the lockdowns and all, obviously that became just worse. In terms of what Nepal did, and I think it really did a combination of things which can be seen as good and had worked, and something which kind of, could have improved. And still there are areas where Nepal is still reflecting upon it. But the discourse and the framing of the relief was not really rural and urban. It was around livelihoods categories. It was about those who have lost jobs. It was around the sectors where people were working. It was around returning migrants. So in that sense, the good thing would be that the urbans were not excluded, but it would also mean that we were basically dealing with a caseload, which is those who had lost their jobs that had not been part of the regular social protection program. So what Nepal did, for example, and this was a plus, I think, just as Bangladesh did, Zilur, as I read your paper, that they gave out 1 month's food to 1.9 million households. And these households had been prioritized on the basis of returning migrants, daily wage earners, and less so on, for example, number of children or single women and female-headed households or disability. So there was a clear livelihood focus and the focus on those having lost jobs, right? So there was an urban slant to that, if you may say, because the sectors which were affected by this job loss were tourism, were construction, were hotel, for example, entertainment industry, as we call them, but also along with that, but roughly agriculture kind of had escaped the brutal brunt of COVID. This is what we found later on, and we were wrong in our assumption in the beginning that even the rural areas would be as badly affected as the urban areas. So so that focus on the livelihoods kind of helped, I think, government reach across to some of the households which had become newly vulnerable and newly poor. So that was a good kind of inclusive strategy. There was also a great role given to the wards, and this was the first time, in fact, the wards selected the households which will be receiving social protection. So this was kind of a new role, but I think they delivered reasonably well on that. And I think the government would be building upon that kind of experience and capacity which they gained during that time. But it was all new. So there were obviously challenges as well, right? In terms of definition, who are the vulnerable? How do you define who have lost jobs? How do you maintain that register dynamic? There was another arm of this response, which was employment-based, or rather the Prime Minister's Employment Guarantee Program, which ramped up to create 200,000 jobs. But that was difficult, again, to implement because this was not necessarily tied down to a mature social protection program. So it was pretty much, in many ways, what Nepal was doing was building a ship as it was sailing, because it was learning. They hadn't, as Ugo was saying, we were caught kind of unawares. We hadn't expected the implication of such a pandemic on poverty and vulnerability and all the needs which needed to be addressed after that. The government was also it also showed its commitment by honoring its planned social protection response. So it expanded to 11 new districts, the Universal Child Grant Program, which again is a big plus. And what is interesting and important about Nepal is that its programs are not poverty focused, or they are not rural or urban focused. They are basically categorical. So if it is child grants, it will be available in urban as well as in rural municipalities. Again, that kind of response must have made Nepal's program more pro-urban than otherwise possible. In terms of other kind of responses, for example, there was delayed income tax, there was emphasis on financial inclusion, there were loans for medium and small enterprises. Again, there was a clear urban slant, if not urban poor slant, because these were all for those who were already part of a formal system and were financially included. Overall, the budgetary layout increased by 1.5%. So that was 2020. Now, in 2021, what we see is that the government's response has been different. And hence, I said there is a bit of a lack of consistency in terms of how the government is deploying its social protection programs to address the secondary impact. In 2021, despite a massive, rapid onset of job loss and livelihood loss that we reported on, because we were quick in conducting, again, a national survey on 21st and 23rd of May, and we shared the findings with the government and with the other development partners. It was disseminated widely by media. Despite that, government did not implement kind of a cash response or even a food response. So we are still, the advocacy is still on. So we are still hoping the government might be doing something. What it has done in the budget, it has substantially increased the benefit size of the regular social protection program. So kudos in that sense that it has built upon its regular social protection program, but the additional benefit will reach people only in September. So while it is good for the regular social protection system, it doesn't really help people who need assistance right now. In terms of the urban slant, it has given subsidy to those who are consuming 20,000 liters and below. Again, I think that will probably benefit those who already have piped water supply, but not necessarily give a lot of consideration to what it means for the revenue mobilization of the water sector. And in fact, drinking water has been allocated 1% less than last year. So again, not a very positive one there. There's electricity subsidy, again, in this package, which is again good for urban, I guess, especially those who are paying metered, those who are connected properly and are part of the formal meter supply system. There are loans to students and again NSCs. Okay, so again, you don't find kind of an urban poor slant, but there's obviously some sort of urban slant. Overall budgetary allocations have increased by 3 percentage points. Again, a great thing. So what are the challenges of urban social protection? And just in kind of, recapping as I move towards my last slide, we traditionally have been focusing on chronic poverty, right? So we say, and chronic vulnerability or age-specific vulnerability. So Nepal's social protection programs are really about like old age pensions, under 5 children, single women and female-headed households and endangered ethnic minorities and persons with disability. It does not really have a category called new poor or the vulnerable. So that is the challenge. Now, we understand that, poverty estimation is just one point. It doesn't give a range. It doesn't say, okay, these people are poor and these might additionally fall in poverty. The programming and the policy response are really not so vulnerability focused. It's all about poverty and a static nature of poverty focused. Now, there is also this whole issue of internally displaced and hence those who become kind of internal irregular migrants. And that is the nature of urban poverty, or the urban working class population, which moves from the rural areas into the urban areas. And these people don't necessarily have all the right documents. And the challenge becomes all the more acute because the kind of documents which are required have to be procured from their so-called permanent residence. And the permanent residence in this case often means the place where they were born, the place where they grew up. So this irony of kind of asking for permanent residency from a population which is intrinsically mobile is also something which is making us kind of register these newly vulnerable or existing vulnerable into a system much more problematic. In terms of what I think is still working for Nepal and has helped the response being more pro-urban poor than it would have been is, as I said earlier, that its programs are universal and categorical. They straddle across rural and urban areas. There is also this increasing responsibility of the local governments, which means that they will be able to identify vulnerable populations and newly poor much more easily and in a more dynamic fashion. The World Bank is also, and the government of Nepal are also implementing a social registry, which is a much more comprehensive database, which will probably give us a better understanding of the vulnerability across populations. There's a great emphasis on financial inclusion and emphasis on direct bank transfer, which again would make it much easier to push cash. The Universal Child Grant is being expanded, and as I noted earlier, the government honored its commitment even facing the financial crunch. If we were able to cover all children under 5, which is what the government is committed to by 2024, by giving cash transfers to those families, we could potentially reach 50% of the population. There are also innovations in employment programs which are happening, for example, in Kathmandu, the Keep City Clean, and Zilur, you made reference to that kind of adaptation of the public works program. We see some of that happening in Nepal, so that's a great plus. The other good, great plus, I think, and a good outcome of all this kind of confusion around who should be receiving relief and people rushing to the courts asking for upholding of the human rights is that Supreme Court has basically made it very clear that relief should be de-linked from citizenship. but it still requires certain documents, and those documents are often procured from the palika or the municipality of the permanent residents. Last but not the least, in terms of long-term development and long-term system strengthening, Nepal's development plan, the 15th periodic plan as they call it, makes recognition of the shock responsive social protection and kind of makes commitment to it, but obviously hows are still missing. But in terms of vision, they recognize that and they reiterate that vision and that commitment again and again in many policy fora. So that's all from my side.
Okay.
Thank you.
Thank you, Usha, for sharing the Nepal experience. And I should also add that in Bangladesh too, actually agriculture was a savior during 2020. You know, like Nepal, Bangladesh agriculture too, and our survey also showed that the income recovery in agriculture was actually distinct. It was the only sector which showed a recovery beyond the pre-COVID levels. So that's a interesting, good to know that. And also I think many of the issues that you have highlighted and the fact that there has been a more of an urban attention in Nepal than perhaps in Bangladesh. But I think you have also rightly noted the challenge that I think similar in Bangladesh, that yes, emergency response, some innovations have been done, but come to 2021, now the question of building on it, mainstreaming it, going the next stages, those remain to be done. But I'm really heartened also by seeing that there is a recognition of this, what we are calling the new poor, as a legitimate new sort of idea around which social protection needs to also look at, as this sort of crisis, etc., might continue. Thank you very much, Usha. I'll now move to Asif Saleh. He unfortunately has to leave after 9 o'clock. So I'm giving him the floor with the apologies to Azmat Isa. Asif Saleh is the Executive Director of BRAC. Asif, floor is yours.
Thank you, Zidar Bhai, and thank you, Hugo and Zidar Bhai, for the great presentation, and it resonates with that. So I'll try to give a slightly more ground level view in terms of what we are seeing on the ground from BRAC's extensive presence on the ground and how it resonates with what we are seeing. So essentially, I mean, Bangladesh has seen a fairly steady growth over the last 20, 30 years. I mean, barring occasional natural disasters, which has affected particular areas. And so when a natural disaster like a flood or a cyclone hits, then, you know, an entire area gets affected. So you have intervention that affects, that supports the entire population. But what we saw with COVID and then the subsequent lockdown from an economic perspective is something very unprecedented, right? So there's a whole like brand new group, and this group is not homogeneous at all. And this is again, like Zidar Bhai said, the people who are dependent on farming, they were relatively okay. People who had multiple sources of income, they were okay. But there are very interesting blend of group who were not poor before, but were coping well, relatively well, but suddenly fall out of the poverty. And this is, I think we were having a hard time understanding some phenomena, but when this articulation came in of new poor, that really helped us look at this group in a very different way. And essentially, what we are seeing that from a programmatic intervention perspective, that this group does not require traditional intervention that we have been doing, say, for our ultra poor intervention, or even say financial inclusions such as microfinance intervention that typically goes in. They are somewhere in between, I would say, people who are getting the microfinance loans versus people who are known as ultra poor who get asset-based support. So they're somewhere in between. And if I look at also this whole, again, very similar to Nepal as well, that we saw that urban-rural continuum phenomena here. We saw that a group of urban poor who got, urban sort of low-income population who got laid off returned to their villages and were struggling to find a new source of income. And they were also in a somewhat of a limbo situation, not being able to decide whether they're gonna stay in the rural areas or they're gonna go back. In some cases, we saw that between partners, husband decided to go back and the wife stayed in the urban areas. And so we decided that we need to come up with a criteria where we can support this group who doesn't need a long sort of intervention, but somewhere just need enough to cope with this current crisis, just for them to lift them up. Typically, our ultra poor intervention, you are most likely aware that it has this long sort of a 2-year intervention that has weekly coaching as an asset transfer, and a lot of sort of different types of intervention that goes in. And for this group, I mean, you don't need that coaching or mentoring to kind of build up their agency. They have it. They were just in a sort of a temporary situation that needed that kind of support. So we identified. We tried to identify this group from a programmatic perspective in different ways. So there was 2 phenomena. One was this very sort of segment of population who got the worst of this brunt. For example, the migrant workers, international migrant workers, so who has like a heavy sort of a loan when they went abroad, and so had to come back, and then didn't have any earning or savings, but they were lumped up with a loan, big debt. Then there is a group, for example, the families who lived off migrant remittance money that was coming in. So their remittance also, even though the person didn't return, but their remittance money reduced. So there was an interesting phenomena here where the macro situation showed that Bangladesh's remittance money was continuing to increase even during this COVID period. That was because of government introduced a system to incentivize sending money by, I think there was gonna give 2% additional sort of incentive on for people to send money through the government formal channels. So that, I think, so from informal sources, the money moved into the formal sources, so which inflated the total number. But when we looked at the household level, there was a research published with New York University yesterday, which actually showed that average household dependent on remittance money, that their income reduced by about 58%. And in most of these cases, these were sort of single sources of earning for these families. So they got a big brunt of this sort of hit. Then there are these groups essentially based on livelihood, whose livelihood got decimated. So for example, you have there was this regional element, and then, in Bangladesh, you have, for example, from very few districts where you have most people who lives off like migrant workers. Then there are groups in the southern belt. You have a lot of crab farmers whose livelihood got completely stopped because the export to China and other places got banned. So all of these resulted in these various groups, similarly like sex workers, laid off jute workers, reverse migrants who went back, small businesses that were barely functioning but had to be shut down. They needed additional support. So our idea was that you can't have a one-size-fits-all approach to that. So for the group that particularly required a temporary support, we had an identification criteria where we said that if the income had dropped by about 40%, their savings had dropped by about 40%, and they are returning migrants from urban to rural area, and they either sort of have these split family phenomena, and there is also sort of one source of earning. Those are the groups we started with supporting them with sort of helping them start up a small enterprise. So our idea was that we needed to get them into an area mechanism where they can have at least 2 sources of earning. So in some cases, we started them with a small enterprise, like, whether somebody buying a small van that they can sort of use for sort of renting purposes, or they can get a cow or a calf. So having those 2 sources definitely sort of helped. And that we kind of did with a financial credit program. So that was an asset transfer. It was not an asset transfer. But the additionality here was that training, that the idea that what business they should start, and that handholding that was required, and linking them with the right channels and people. So it was a relatively low touch intervention and a low cost intervention as well. So and kind of embedded off the sort of the existing field operation that we had. So the cost was very low. So for example, so far in our program, this kind of identification of this new program, we supported about 35,000 families. So it's a very sort of compared to the national scale, it's small, but the identification process was quite rigorous. So on average, the unit cost of support that we actually have done was about 9,000 taka, so a little more than $100. So the default rate of this group has been very, very minuscule. So I think so far the response has been very positive. So they are all kind of coping a lot better. For the other group, who sort of, if I can call them the new sort of ultra poor, they require more some kind of asset transfer. This is the sort of the first group that I was mentioning, the migrant workers who were like penniless and laid off workers who they were depleted all their savings. So they required some kind of asset transfer. And support with new businesses. We also had this other intervention where we are supporting small businesses to improve their efficiencies and also help them cope with some level of indebtedness. I think that's another intervention that's ongoing. But I think the challenge for us has been that that people are, I think this is something that Usha mentioned, that people are still mobile. There's this group who stayed in the return to the villages. Initially, for example, we identified 90,000. That was our target group. But now, as we in the sort of 5th month, we are seeing that a chunk of that population has already come back, or they are kind of waiting to take the loan because there's a seasonality aspect. So they are waiting for the crops to come in, and then they will take the loan. So they're also trying to decide whether to take it or when to take the intervention. The urban phenomena, if I come back now, is also very interesting. I mean, I think essentially what I think already have been said, that they got the brunt of it. But I think what was interesting was that in the rural space, it was a lot easier to sort of target people, because there was, and particularly also from the government support scheme, and I've talked to a number of government officials who have also said that there is an existing political structure, and there is sort of the local representation is fairly well grounded. So they had a mechanism to support the rural poor. So for example, when the government announced that they were going to support about 5 million people, but through cash transfer, emergency cash transfer, they eventually finally found about 3.7 million, and most of them are from rural poor. So they had difficulty finding the urban poor, and or are targeting or figuring out a mechanism, because the local administration is relatively weak, and there is not that kind of phenomena. So from our intervention perspective, so initially we did a cash transfer, emergency cash transfer, but then we actually moved into an experimental program where we kind of gave a blanket sort of support with the help of World Food Program and USAID to 2 slums across the board for a year-long monthly stipend to every single household. And that also coupled with some kind of incentive program, so they linking up with the small business stores. If they had bought something from a food sort of package, from a nutrition perspective, they would get some incentives back. But then also there was a separate pilot we started where the Dhaka mayor actually worked with us, formed a small committee, and then went into household to household and identified people in about 10 wards. We did an experimental sort of identification of who should get the support. But that pilot eventually, when the wave finished and the lockdown lifted, it didn't go anywhere. But there is a clearly role of innovation here. And I think Hugo mentioned what Nigeria used in terms of artificial intelligence or machine learning. I think we were also very close in terms of forming up a pilot for that, where we were gonna identify the poor based on their phone record and how much they spend on monthly airtime to identify who should get the support. And this is an ongoing challenge, and I haven't yet seen any sort of mechanism in Bangladesh to actually see that what is the best way to list and target and identify the urban poor. And essentially I think there is a lot of room for innovation here using mission data. I mean, I think the machine learning. So I would say this is I think an area where we definitely need to spend a lot of time on and figure out a systemic way to resolve these challenges. I think that's pretty much from my end, unless you have something else, Zilrubai, I should address. Thank you. Sorry, you're on mute, please, Zilrubai.
Thank you, Asif. I think we are now, the new poor as a concept, really got going during the COVID-19 experience. But I think now we are trying to reach a sort of identifying the types of challenges by which this concept can be utilized for actual programming purposes. I think what BRAC has done here is given a human face to this new point, trying to identify who are these people, getting that social profile, I think was an important, interesting example that you brought out from the Bangladesh experience. And also, I think you have also pointed to, the previous speakers, we have been talking about mainstreaming system building based on this experience. But you are also pointing towards the fact that some of these is also a short-term requirement. People who want to tide over this current crisis. That part of it also needs to be recognized, I think. That is also a very important issue. And then the whole issue of targeting in urban context, the complexity of it, and the subsequent need for innovations is critical. And I think Hugo has given examples, Usha too, and I think we've heard from Asif. Now I would like to bring in Qazi Azmat Isa, CEO of the Pakistan Poverty Alleviation Fund. Over to you, sir.
Thank you very much. It's a real pleasure. Distinguished panelists and participants, a very good evening, a good morning, wherever you are. I'm particularly grateful to Hashmi Bhai for inviting me, and Rahman Saab, you and your organization for having me over. It's an honor and a privilege. You can see it's getting dark here as well. So nearly 8 o'clock. So first of all, I think, this unprecedented crisis that has happened, I think what we discovered in other crises that it's kind of local or whatever, but here, I think what we have learned is that we have to take a whole kind of government, society, humanity approach, everyone coming together and actually lifting ourselves out of this. So my presentation is going to be basically, first just set some context in terms of Pakistan, the overall poverty numbers, people may not, and then actually focusing on the SARS program, which was the flagship program and which was the program that was used to deliver a massive unconditional cash transfer. So Pakistan had its first case on the 26th of February. And then since then, we have about 1 million confirmed cases, 22,000 deaths, and about 10 million people vaccinated. So this is just to give you a sense. So Pakistan, thankfully, has kind of not borne the brunt of this like perhaps India has. Now, in terms of the overall status of poverty, Pakistan is a massive country. People forget when you're between India and China. It's now after the 2017 census, it's the 5th largest country in the world with 210 million people. And in terms of poverty numbers, this is pre-COVID number. So 11% of people in urban areas were poor and 28% people in rural areas were poor, based on the multidimensional index. Now, coming to the impact of COVID, what has happened is this has significantly increased the numbers, and these are estimates that now from a total of 45 million people, we've gone up to 65 million. So when we talk about the new poor, we have 20 million more people. And globally, I believe it's about 150 to 200 million people who have been added to the global poverty numbers. So that's Pakistan has got like maybe 10% of that. Now, in terms of urban and the difference between the urban and the rural in terms of what happened to COVID, we did a kind of a short study in this regard, looking at some value chains and, when we were doing our asset transfer. So it emerged from that study. This is a very small study, but it gives you some sense of, the effect being more in the urban areas. So the urban poverty went up from 11% to about 15.5%. So that was quite significant. And then the other thing is obviously Pakistan's, very in terms of heterogeneous countries. So there is huge variations between the provinces and like Sindh has the highest number of rural poor and the lowest number of urban poor. Balochistan is the reverse and the Khyber Pakhtunkhwa is the reverse in this regard. So this is just a sense of the numbers. Now coming to the urban side, Pakistan's population, Pakistan is the, I think, fastest growing in terms of urbanization in all of South Asia. We have about, it's estimated, the census says that 45 million or 45% of people live in informal settlements and in Karachi, for instance, 17 million people of the city, 60% live in informal settlements. So Pakistan is urbanizing at a very fast pace. And the reasons are, one is obviously we have a very high birth rate, but also because there is a huge rural migration that's going on because of the lack of services that are in rural areas. So that's one of the reasons for urbanization. Now, some of the issues with regards to COVID, which are highlighted for urban areas, is basically the fundamentals, like for instance, access to water. Now, when the SOPs came out, we looked at, in terms of washing hands, just washing hands would cost, $1,200 because water comes at a price. You have to buy water in the urban slums of Karachi. So just if you were to follow those protocols, a family it would cost a family 1,200 rupees more to just follow the protocols and buy extra water. So just to give you one sense of it. And then obviously these squatter settlements are very, very dense and very, so they're very prone to, in terms of their, in terms of health and disease and stress and gender-based violence. So those are the kind of manifestations in the urban areas, which are perhaps not so pronounced in the rural areas. Now, just coming to the SRS program, and I'll just give you a sense of the SRS program. SRS program is by far the flagship program of the government, and it was started in 2019. It has 4 basic pillars. The first pillar is governance, the second is safety nets, the third is human capital development, and the fourth is jobs and livelihoods. Now I'm just going to focus on one of the biggest programs within the safety net is what was called the Benazir Income Support Program. And this was started 2 governments ago. And it had a registry of about 5 million people, 5 million households were on that registry. Now, what has happened is that the identification of poor was done through a process called, with an instrument called a poverty scorecard. Now, the poverty scorecard used, and it's an asset-based instrument, so it's not looking at incomes or expenditures, but it's looking at, I mean, proxy means, and this was done pretty much universally. And from that, based on the government financial capacity, they had a cutoff of 16 on the poverty scorecard. So the scorecard worked in a way where the lower the number, the poorer you are. So if you are 0, you have no assets, and if you're 100, then you're not poor. So, and then, like my previous colleagues have mentioned in terms of the variations, the heterogeneity of poverty, it's not a homogeneous phenomena. So the government, when it first rolled out the Benazir Income Support Program, had the money available for people up to 16% on the scorecard. Now, so when the program for this emergency cash was designed, there was a database that already existed based on this poverty scorecard. So just to give you a sense of what was achieved during this, first of all, like I said, the first case appeared end of February, and by the 1st of April to 2020, this was launched, the SARS emergency. So, and this was a period of from April to September, the first kind of tranche was given out. Nearly 200 billion rupees were dispersed. The program provided rupees 12,000 to more than 15 million families, and through a biometrically enabled payment system. And payment to these beneficiaries was made through more than 18,000 points of sale, retail shops, of 2 major banks. Now, in terms of how was this achieved and some sort of challenges that were faced, I'm just going to talk a little about those. So first of all, you can see that, it was a very fast response. And I think one of the reasons was that there was this kind of digital architecture that was available that could be leveraged. The second was that there was a very good government coordination and ownership of the program. The third was that there was a dynamic social registry. So what they did was they said, okay, they looked at the program vertically and horizontally. So vertically, they said, we have this 5 million database of people who get the unconditional cash transfers. So they topped that up by 1,000 rupees for them per month. So normally they get 2,000. For the 5 million, they got another 1,000. Then what they did was they upped the score from 16 to 29 on the poverty scorecard and said, we will now include those who are also part of this up to 29. And that added a few more million people to it. And then they also had a SMS service. You could dial 8171 and you just wrote your NIC, which is the National Identity Card, which every Pakistani citizen must have. And you just write that on the mobile message and you will be then assessed if you are eligible or not. And then I think, so these were the kind of the reasons why it took off. And obviously, I think one of the key elements was that the leadership that was demonstrated by Dr. Sania, who was the Minister for Poverty Alleviation and Social Safety, I mean, was remarkable. And I think that was set the tone in terms of transparency and ownership and an institutional response. So these were some of the key salient features. And basically Pakistan, for some reason, because we are like the fifth most vulnerable country to climate change, we've suffered earthquakes. There was a huge, massive earthquake in 2005, 72,000 people died in that. So Pakistan has been, there is institutional capacity to deal with these large scale disasters. And like I said, in this particular case, there was already the leveraging of the SR's digital infrastructure was very, very effective. So the other thing was that there is this national database, which was triangulated with, and they were the ones who were actually used, it's called NADRA, who had this exclusion list. So people that, had mobile, so they had a whole range of criteria, which that excluded the people who were not, who were not classified as poor up to the 29 score. And that was like, if you had a phone bill in the last 6 months of more than 1,000 rupees, if you had traveled abroad, or if you had asked for a passport, all of those things were put in place. And then 139 million responses were received, and of which 16 million were then deemed eligible, of which 15 million actually got their dispersed money. So this was the kind of the scale of this thing. And the other thing was at the cash dispensation, a biometric verification system was used. So there was it was very transparent, and the beneficiary had to be there themselves. Now, interestingly, the cash transfer, the 5 million cash transfer, was basically only for women. But in the additional 10 million people that were added, that was for men and women. So overall, this benefited about 54% women, of which the 5 million who are the beneficiaries of the Benazir Income Support Program are 100% women. Now, in terms of, obviously, there were huge challenges. The COVID protocols themselves, you know, the masks and the gel and the transportation and the cash liquidity and logistics. So this was like I said, the whole government approach was, you know, many agencies were involved, including, you know, the police, to make sure that there was law and order, and huge amounts of cash were being dispersed. There was safety. So by and large, those things went really, really well. Now, in terms of just some lessons, you know, so the coverage, if you look at the numbers, and if you look at 15 million and you multiply that by about 6 to 7 per household, we're talking about 100 million people benefited. So that's nearly half the population of the country. So that is pretty, you know, large scale. In terms of the adequacy of the amount, 12,000 rupees, obviously this was not, it's not a very large amount of money. And I think the daily needs, about 5% of daily needs were met by this amount. But there was obviously Pakistan has a fiscal constraint. So this was the fiscal, and this was pretty much money that came from their own budget. Very little money is from donors in this. So the 200 billion is primarily Pakistan money, and that has been preserved for last year as well as now in this next budget as well. So the SARS program has another 200 billion, in fact, more this time, 250 billion for the 2021-22 budget. So the government is committed to continuing the social program as well. The other thing in terms of inclusion, because it was so high tech that one feels that perhaps some people in remote areas, Balochistan, the tribal areas, they may have lost out. And I think these are things that one needs to look at in the future, to make sure that, you know, those people who don't have access to the internet or mobile phones, and, you know, so even the 8171, because you have to type it in and you have to have credit in your mobile, a lot of people complain that laborers don't have credit who don't have. So then that became a free service. Government actually subsidized that call as well. So saying, okay, you can just send the message 8171 to 8171 and you don't have to pay for it. Then there was the issue of the national identity cards. The identity cards were like, they had to have a valid national identity card. And then a lot of people like say, you have to renew the identity card. And then because this was posing a lot of problems, then that condition was dropped and said, all you need is an identity card. Doesn't have to be valid in terms of its expiry date. And the other thing is that the second round has also just begun. You know, about a couple of weeks ago, the second round, which is going to be, again, it's based on this fiscal envelope that the government has. So it's going to be the 5 million existing BIS beneficiaries who will get the extra 1,000 and an additional 4 million who will get 12,000 cash as the unconditional cash transfers. So though I was asking, you know, what is the kind of urban, rural, and this is neutral. This, from what I understand, is that anyone who doesn't have those, or the poverty scorecard, like I was mentioning, either. So it's urban, rural, blind. So it doesn't really target a particular, you know, section. It's like, okay, so whoever has a lower score, wherever they may be living, is eligible for that. So roughly about, I'd say, about 35 to 40% of this cash handout probably went to the urban areas as well. Now, obviously, this has been, I think, government's quick response made sure that people who were very vulnerable, they had food on the table, the daily wages, and a lot of, and, you know, especially service industry people. And I think what they've done also, the SARS program is a very holistic program, and even within the social safety net, a part of this, the second pillar of SRs, there is this program, which is the conditional cash transfers, but they're all unconditional. They also have a whole range of conditional cash transfers, which are related to education. So from primary to secondary to middle to high to up to graduation, they have a conditional cash transfer for education. They've just started a conditional cash transfer for nutrition in 13 districts. And if that goes well, then we intend to scale it up as well. Then there is this, the thing that we've adopted from Bangladesh, which I think we are particularly proud of, is that we were always engaging with the government saying that, this is great that you should give this cash transfer. It puts food on the table and, helps people, the vulnerable households, but they should have a graduate, they should have hope in terms of, setting up their own livelihoods, and they should be thinking of graduating out of this. So they're off your books. So we've been doing this, and after the survey came out and it had so much traction from, everyone, and we managed to convince the government to make it part of the SRs program. So you'll be happy to learn, my colleagues in BRAC and Hashmi Bhai, that it is now, of the many interventions, these are the two significant interventions. One is the asset transfer program, and the other, which is like we've added this ourselves, it's a very large interest-free loan. And the government has just put 5 billion rupees extra about just a couple of weeks ago, because they see that there is a lot of value in that as part of that. So there is the whole, like, I think, Ugo was mentioning that you can't see these in isolation. Each of these programs complement each other. And I think they can provide ways of providing good safety nets. So I'll be happy to answer any questions. I'm grateful for the time. Thank you very much.
Thank you. Thank you. That was most informative. And I just want to note for myself and for others also, particularly three things which came out from your, I think the use of leveraging technology in terms of database, etc. You seem to have given a lot of attention there, and it has paid off in many senses. That was, I think, an important, perhaps a signal to other contexts also. The other is, I think, Usha also raised that issue of this. Posing this as a question, is there when you are thinking of taking this forward, is there a trade-off between benefit size and coverage? Bangladesh, for example, seems to have preferred the coverage part of it. In the small increase in the old age allowance program and the widow allowance program, the focus has been on coverage increase rather than the benefit increase. So that's also, I think, one of those tricky debates we have to engage down the line, because benefits, I think, is a very important issue. You will see in our study report, which will be launched later, is that this problem of tokenism can kick in if the benefit is kept at a very small level for a very long time. And the third one that you also mentioned is, I think, very interesting. And I don't know whether the Brazil's program also was built around that. I mean, the whole idea that a country needs a flagship program around which then to package other programs. The SRs was mentioned, whether that's also a strategy that one follows, that you build traction. There is one program, a flagship program, which is successful, and you build on that success by packaging other programs around it. And is that also one of the lessons? So thank you very much, Qazi Azmat Isa Sahab, for that. And now I will come to our Dr. Shamsul Alam. He's a key government functionary. He has been the lead in developing the last 3 5-year plans of Bangladesh, the 6th, 7th, and 8th. And he has been keeping he's kept oversight on all these new issues are coming up, very receptive government functionary to new ideas, but obviously also have to use his government hat to assess which can be taken up, which can be pushed forward for. Dr. Shamsul Alam, over to you now.
Thank you very much. I heard all of the presentations. first one with you and others, quite interesting and stimulating, no doubt. But certainly I will be confining with Bangladesh issues, obviously. So the topic is very important, particularly at this moment while COVID is ravaging in a big way. And I fully agree with Dr. Hussein Jillu. There is urgency of rethinking of social protection, obviously, particularly at this COVID ravaging situation. And the vulnerabilities you identified, I fully agree. There was a earning uncertainty from the beginning of the COVID infestation, and obviously rising non-food expenditure is quite likely. It's a logical follow-up when income is declining or dwindling. Certainly, there will be rising non-food expenditure. And you also said eroded financial coping capacity as one of the vulnerabilities. Sure, certainly. But the issue of new poor, you said, remain unaddressed by social protection programs. Obviously, I mean, it's suddenly fallen. I mean, who knew that COVID will be ravaging so much, will be coming in a so big way. Of course, obviously, I agree. I mean, nobody could visualize that second wave, third wave will be coming. We thought maybe after 6 months, 1 year, it will be declining or it will be under control. But thing is not in that way, obviously, you all know. So new poor unaddressed in a sense, actually, in some way addressed, I will say later on with the government different programs, which have not much come into discussion by the civil society. Anyway, you figure that 24.5 million actually fallen into poverty. That's a big number, obviously, though we say we have 2 crore in our estimation, 2 crore absolute poor we had, and 1.6 crore moderate poor. Altogether, 3.5 crore people were under poverty line. Anyway, certainly there was increase of poverty. I mean, no doubt that is transient. I mean, transitory. I would say poverty is not any static figure. In every year, normal year also, you quite know that. If there is flooding, if there is drought, if there is tidal surge, cyclones, in that case, many households, those who are at the borderline or a bit higher than poverty line, they fall back to poverty. That's a dynamic thing, actually, poverty number. So this time, this has drawn the concern because number may be big this time because of employment fall in the informal sector mostly, and losing of services in many of the traditional service sectors. So that is okay. And about the social protection, you rightly said, has ignored the urban poor. Not altogether, and there are programs, but not that much as we have in rural areas. You have said that in urban areas we have GR, we have BGF, we have OMS. In rural areas we have other programs included, small and big programs. And the reason, as I understand, while we talk about social protection implementation, the general feeling is that the urban poor, more or less, they have more access to income generating activities, that they can work as homemade, or their husbands can go for rickshaw pulling or vendoring, or become itinerant traders like that. So income opportunities are higher in rural areas, number one. Number two, there's a feeling that if we cover the urban poor as we do in case of rural, then many may feel tempted to come to urban areas. There is also that thinking in the policy level, as I heard many times, many say if we go with full support, many would feel allured to come to urban areas because urban is always centers of attraction for jobs. So that is one of the reason. Policymakers carefully, even I should say carefully, they did not give much attention as of rural poor. In rural areas, you all know, and there is problem of employment opportunities. And sometimes you have seasonal employment, and sometimes you can find in off-crop season, you can find jobs there. So that kind of thing is there. And about the social protection spending, you said not much increased. You gave figure for 2019-20 saying 16 point, as I remember, 16.32% was at that time, and increased marginally in 2022 and 16.83. But how about 2021-22, this year's budget, where total amount has increased to some extent, I should say, from 95,000 crore to 107,000 crore this year. Of course, this is not a big increase, but there was increase, no doubt about that. Focus for longer term is not visible because it is actually nobody can understand which way things will move, particularly with corona infestation. Once it seemed that it will be under control when it came down to 7%, 8% infection rate of tested cases. So anyway, that nobody could visualize, not in government, not in civil society, who knew and who predicted that we are going to have, we are not, we have to survive with COVID for 2-3 years. Who knew that? Anyway, there should not be any plea for not having enough social protection supports or activities. And Dr. Hussain Jillu's comment I carefully followed because he has very practical experiences. He said beneficiary listing is challenging, and so we have to involve. There is importance of community engagement. Should it be community engagement? As Asif said very nicely, I heard that in rural areas we have more natural leaders, more institutions, visible institutions than urban areas. And in rural areas, our NGOs work more intensely than even urban areas. Even not only government, in NGOs also prefer to work in rural areas, as we see. So why not? If we can engage NGOs, those who work for longer time in rural areas, they work with the poor people, marginal people, they know better than any other institutions in rural areas. So would it be possible? It would be better, I think, we can, if we involve establish NGOs with reputation while we go for searching for who is poor and who is not. Unless we have national database on household database, where we'll be able to know income level of each household. So that was one of our proposal in the National Social Security Program. I led the preparation of that. We proposed that to have household database for the whole country, where we'll be able to identify household by income also. And then by following proximity test, we'll be able to identify poor. Anywhere that has not been materialized so far. And if that would have been done, I think it would be easier to identify poor, and we could avoid